respected Dr. Naresh Bhati sir, as well as Dr. Chetan sir, from Parul Institute of Nursing as well as Parul University, Vadodara, Gujrat. Today, we have planned to organize one webinar activity, especially for the nursing professionals. Those who want to pursue their career in the overseas countries, especially in the Germany. So this today's webinar is planned for the nursing professionals to give the idea about the ethical migration for the Germany country, as well as the guidance for the job security, as well as the ethical migration activities. So first of all, I would like to welcome as well as a thanks to Dr. Naresh Bhati sir for accepting our invitation for this webinar activity on the behalf of Parul Institute of Nursing, Vadodara, Parul University, Gujrat. Thank you so much, sir. I'm just going to introduce our respected speaker, Dr. Naresh Bhati sir. Sir is an educationist, entrepreneur, and the visionary by profession, doctor, and Director Dean of the Welfare College of Education and CEO of Welcare Overseas Education, Karnataka. Sir has guided too many nursing professionals as well as other healthcare professionals toward the Germany as well as the over country migration as well as the job secure purpose. Sir has guided as well as sir has running the consultancy as well as the education college for the welfare for the professionals. Those are pursuing the education in the nursing as well as the other healthcare. So, without wasting too much time, I would like to request respected Dr. Naresh Bhati sir, kindly proceed with your presentation.
Yeah, Mr. Chetan will step ahead here, then later on I will take on.
Yes sir, no issues. Sir.
Yes,
thank you, sir.
Thank you so much. That was a wonderful introduction of Dr. Naresh Bhati. And I would like to introduce a brief about the Welcare Overseas Education first, and then Naresh Bhati will continue with the presentation. So this is the first one, and in 2008 it has been established, and it has been one of the best consultant for study and to work in abroad. And in countries like Germany, Italy, Ukraine, Georgia, America, and Kazakhstan, Russia, and here in these places we have been placed too many students for the MBBS and free bachelor's, masters in engineering as well as management, hospitality, and arts in Germany as well as in Italy, and then free medical PG for dentistry in Germany and free nursing in Germany, and nurses not only studies but also we are placing the nurses those who have studied in Germany or in India, and we are placing them in Germany the nurses jobs. And we have paid internship for agricultural fields in Denmark, Norway, and Sweden, and as collaborations with other countries with the education line. And as already we have the brief about our Dr. Naresh Bhati, the MD, Dean, and CEO, and we have a couple of pictures which will describe our collaborations with different parts of India and with the different colleges and institutions. So this is SGT University, which we held seminar there, and seminar in Rajasthan, and BIMS Nursing College seminar. This happened in Hubli, Karnataka, and this also again at Tumkur Nursing College in Tumkur, which is there again in Karnataka, and this is Bangalore Nursing College. So this is again part of one more district of Karnataka, Shimoga Medical Institute of Medical Science. So this is one more college from Bangalore, Ashwini Nursing College. And then sir will continue with who can apply for this job in Germany. Over to you, sir.
Yeah, thank you. So this continue click on that, so it will whole screen will come. So before to start this session, I would like to thank you Parul University and Nursing College of Parul, the principal sir and whole staff for inviting me for this such precious day to help those aspirants, especially for the nurses who are looking for career in overseas. And especially we're going to talk about today about the Germany. So why nurses should go Germany, why they have to choose the overseas path, and what benefits they are getting in the particular country. So I will start with the which all nurses. It is all about the nurse career in Germany, which all nurses can go to Germany, who can apply for this. So first, the start with the ethical migration for nurses in Germany. First, the point we're going to take today is who can apply for nurse job in Germany. So if you are GNM nurse, if you are BSc nurse, if you are post BSc nurse, if you are MSc nurse, if you have such kind of qualification, you are eligible to apply for nurse job in Germany. Now the second point in this PPT, if you are seeing the experience. So experience we have mentioned here 0 to 1 year. That means when you are completing or when you are in your final year, you can start your journey for learning the German language. So we uh, minimum from 0 to 1 year also we can expect. If you have 1 year experience also, that is also fine. If you are fresher also, that also it is easy for you to start journey for nurses. So in next slide you are seeing that nurses are in demand in Germany. Which all nurses are in demand in Germany? So one by one we are going to discuss. The first there is written operation theater nurse. So if you have an experience in operation theater, that nurse highly in demand in Germany. Then if you are working in a pediatric department, pediatric nurses are in demand. If you are working in ICU, intensive care unit, you are in demand. If you are working in NICU, neonatal intensive care, those nurses also in demand. If you are working as an emergency nurse is also in demand. Then medical surgical nurse, geriatric nurse, and finally general nurse who are working in general ward. So we can see here these kind of nurses are in most demand in Germany to work as a staff nurse. So now we going to talk about the benefits. What benefits you can get in Germany to work as a staff nurse in Germany? So first, if I say every professional, it is not about the nurses. Every profession, whether it is doctor, dentist, or any other profession, the first our preference should be we should get a good salary. We should have an handsome salary where we can survive. We can make our life better. So the first we talk about the high pay scale salary in Germany. So in the world, if we talk about the nursing field and the salary in the world, first country is Luxembourg, which is also in Europe, and the second highest paying country, Germany, where you get the pay scale a salary about 2,800 euro to 3,600 euro per month. So this is we will talk in detail in further steps, but I am just elaborating here a little bit. Second point, the benefits we talk about is free education. So any nurse, suppose they are BSc nurse or GNM nurse going to Germany and working as a staff nurse in Germany, once they become registered nurse in Germany, then if they wish to do their higher education, Germany gives a free education for all aspirants. It is not about the medical professional, even though the non-medical professional also they give free education. And if they have kids, suppose any nurse are married and they have kids, their kids education also they can get free in Germany. Third benefits, if we talk about, if you are working as a staff nurse in Germany, then you can get annual paid leaves about 28 days per year. You can get annual paid leaves, means your salary won't be deducted for that particular time. Next, if we talk about the benefits, as a nurse, you can travel throughout the all 28 European countries because you will be getting a Schengen visa, and that visa states that if you have one country visa, you can travel all these surrounding European country on the same visa. You don't have to need any further visa. So this is also an important benefits where you can explore yourself. You can improve your intellectual knowledge also by meeting the different countries people. So you can have the better knowledge according to this benefits. Next, we talk about the best medical infrastructure. So that state that if we see in India, what we are using scanning machineries like USG, like MRI, CT scan. If we talk about surgical instrument for operation theater, so all instrument, mostly India is the largest importer for the such kind of medical instrument, and Germany is the largest exporter for these medical and scanning machineries. So you can see that the country where you are going to work in a particular Germany, those country only importing such kind of medical instrument and machinery. So if you work in that particular country, definitely you will be having a bright future in upcoming days. Next, if benefits we talk about is quality of life. So in Germany, if you see, the average death age is about 80 years to 100 years. Means the quality of life is really good in Germany. As we state that Germany is a developed country and also ruling country in the surrounding European countries. So quality of life you can get in Germany. And the eighth last, we talk about if a nurse are married, nurses are married, or any nurse is married, then if they have kids and family, if they want to take their family or spouse in Germany, then once you become a registered nurse in Germany, after 4 to 6 months, you can become a registered nurse in Germany. Once you pass your nurse license in Germany, then you can apply for your family visa also, you can apply for your spouse visa also. So these all the major factor or benefits where you can get in Germany as a working staff nurse. So now the requirement, the major requirement we're going to discuss. First we discuss you should have a GNM diploma or you should have a BSc nurse, you should have a post BSc or MSc, those degrees or diploma if you have. Along with that, if you want to work as a staff nurse in Germany, the major requirement is German language. So German language is the major fact for Germany. If you know the German language, nobody can stop you to work in Germany. So major factor is German language. So we will talk about little here German language. What is the requirement of German language? So first, before to start, if I tell what is German language, so it is German language also origin from Sanskrit. So as we know, our all local language or state language also came it from Sanskrit. Even though German also came it from Sanskrit. If I talk about world largest Sanskrit Vishwavidyalaya, that is also in Germany. So you can see German also origin of Sanskrit, and the most spoken language in Europe. If I talk about other European countries, those speak German like Switzerland, like Austria, like Luxembourg, Belgium, Netherlands, Holland, Liechtenstein. So those all surrounding country also speak German. So you will be having a larger scales working space for those surrounding country as well. Then the major requirement for German language, there are 4 levels in German language which you must know, and you must have at least B1 and B2 level of certificate. So if I talk about the levels, there are 4 levels in German language for nurses they require. First is called German A1 level, which is a beginner level, you can say starting level, basic level. Then we talk about next German A2 level, which is about intermediate level, like little grammar start in that particular level. And next we talk about German B1 level, where we call is a upper intermediate level. Means here grammar also the basic things, along with the grammar also it will start how you framing the questions. Then at the last, German B2 level, which we called as a excellent level, that means you can, if you have that particular level, you can speak as a native speaker, and that level only we require for that only the nurse required to work as a staff nurse in Germany. To apply for your job in Germany, to apply for an employment visa, the requirement for German language is B2 level of German. So this we have talk about the German language. Next, next important document part is called diploma or degree recognition in Germany. This is also very important document for or applying for your visa application or your visa employment visa checklist. You need this particular document. So I'll explain you what is this diploma or degree recognition in Germany. As you are an Indian nurse, you are registered in a particular state. Suppose you are studying in Parul Nursing University, Parul Nursing College. So, and if you belongs to the Gujrat state, that means if you become a registered nurse in Gujarat, you have to register yourself in Gujarat Nursing Council, then you can work as a staff nurse. The same way in Germany, this is called diploma or degree. Diploma means who are the GNM nurse. Degree means those who are BSc, post BSc or higher degree they have. So what we need to do is the all academic documents, whether it is GNM nurse or BSc nurse, those academic document, nursing academic document academic documents. You have to translate in German, you have to certify, then we're going to apply in the nursing council in Germany. So nursing council of Germany decide how much you are equivalent, what extent you are equivalent to their nurses. Indian nursing degree or diploma, how much or what extent is equivalent to the German nurse. What our academic curriculum is equivalent to the German nurse academic curriculum. So basis on that they differentiate or in two part. One is called partial or half recognition. That means if you get partial or half recognition in Germany, you have to have a nurse license preparation in Germany. So once you have B2 in India and going to Germany, you have to do nurse license preparation in Germany. Then from there, after preparation, this preparation also hospital going to give you, that will be also free of cost. And after this 4 to 5 months or 6 month preparation, you have to write nurse license exam in Germany. And once you pass that nurse license exam, then you become a registered nurse in Germany. And what comes in nurse license exam, it is all about the practical exam, like how a nurse to nurse communication, how a nurse to patient communication, and how nurse follow the protocol as per the doctor prescription or medication, how they follow according to their department, which department they are working, whether it's an operation theater nurse or pediatric nurse or surgical nurse, whatever it is, accordingly you will be having the exam. So it is easy to pass this nurse license exam because already you are nurse and you know those all practical knowledge. Second is we called as a full recognition. Full recognition means that state you are completely equivalent to the German academic nursing academic curriculum. That means you don't have to write nurse license exam in Germany. If you have German language B2 and you're going to Germany, you don't need to write any nurse license exam in Germany. Only the hospital going to give you beginnery preparatory training to work as a staff nurse in Germany, and after 2 to 3 months of training, you can directly register as a staff nurse in Germany. So this is the difference between the half or half or partial recognition or full recognition in Germany. So this is also an important document for nurses for employment visa document. So next we talk about what documents all you require for applying your diploma or degree recognition. So these are the list of documents. If you are not aware of it, you can see this list of documents and you can start preparing yourself to apply for degree or diploma recognition. So first you should have your CV or resume. Then you must have your birth certificate. Then if you did GNM, then diploma. If you did BSc, post BSc, then degree certificate. Then if you did any internship certificate, your nursing registration certificate, your nursing transcript, and if you have any experience, as I told you earlier, we need 0 to 1 year experience. That means you can start your journey from zero also. So if you don't have an experience certificate, also fine. And if you have, it is well and good for your profile. Then if you are married, then marriage certificate. If any name change before or after marriage, that certificate, and your passport copy and one passport size photo. These all list of documents you require for applying diploma or degree recognition in Germany. So that you have to follow. This is the protocol. Accordingly, you have to follow. So now the next is the most important part we talk about, because every nurse has a concern about the salary. So salary is the most important part for the financial source, and definitely everyone at the end we have to think about the financial sources only, because without finance we cannot do. When your pocket is empty, then you only think of how to make food and living. But if your pocket is full, then you can think of extra curriculum activities to explore your career in other way also. So this salary is very important in the particular part for Germany. So we'll discuss in detail here about the salary. So if you not registered nurse. Suppose you have B2 German language and you going to Germany and you get partial recognition in Germany. In that case, there will be a training for your nurse license exam. So period of time, your salary before become a registered nurse in Germany, your salary vary from 2,250 euro to 2,800 euro, which is equivalent to 1,92,000 to 2,40,000 in Indian currency. So that range of salary you can get before becoming a registered nurse in Germany. And once you become a registered nurse in Germany, then your salary also increase and it is fall under 2,800 euro to 3,600 euro, which is equivalent to 2,40,000 to 3,06,000 rupees in INR. So you can see this is the very good salary you are getting here in Germany. And we talk about the salaries slab. So in India, we say currency is rupiah and paisa. The same way in Germany, currency is euro, but currency is divided into two parts. One is called brutto. So brutto means it is dividation on based on the salary. So brutto is we called as a salary before tax deduction. So the salary which we are representing over here, that is brutto salary. So that is before tax deduction. And second one is netto. So netto salary is after tax deduction. Now, if we talk about the taxes, tax uh, tax syllabus, how much will be? Then in Germany, if your salary less than 5,000 euro, then you may have taxes about 32% or 33%. So that is as compared to India, also we are paying almost 30% income tax. So that will be fair enough for you people to paying these taxes. Still, you can have a good handsome salary. If you are getting 2,800 euro before recognition, that means after your tax deduction also you can save all expenses 1,50,000 around. You can save your money, even though you are paying the taxes in Germany. And once you become registered nurse, you can easily save every month 2 lakhs rupees apart from all your expenses in Germany. So this is you can become a financially very strong according to your future aspects. So as we talk about the taxes, many of nurses have a confusion about if they are getting that much of salary, what will be the taxes slab? So taxes slab I already told. Now what are the benefits you going to get if you are paying taxes in Germany? So first you getting the free education in Germany for yourself, and if you have kids, for them also. And for kids also, if you have kids and you apply there, you get extra pay for your kids, like 400 to 600 euro you can get extra pay for kids if you have your kids over there in Germany. Second is you get medical insurance. Third, you get medical any emergency if you have. Fourth one, you get emergency paid leaves also you get, and annual paid leaves also which you are getting, that is from paying the taxes. And the most important thing for paying taxes in Germany, after retirement, paying taxes back to the payer. That means suppose you are giving your service to the particular hospital in Germany for 10 years or 15 years, and when you are on retirement, the whatever the taxes you are paying in Germany, you will get reimbursement for your further daily life in upcoming days. So this is the best benefits what you can get paying the taxes in Germany. So you should not worry for paying the taxes in particular country is called Germany. So the last point is about the services and cost involved. So here we talk about what cost going to be involved, what the expenses you can bear over here. So as Welcare Overseas Education is not going to charge any company service charge or any service charge. We don't charge any service charge as a, but the minimum things where we have you have to invest for yourself, for your making your profile strong to go Germany. So as written over here, initial document assessment. So which is cost comes about 30,000 rupees, which you have to bear, because once you are ready to start your German language, parallelly we take your documents to do the assessment through the German employer. So in that case, that cost comes around 30,000 rupees, which you have to bear. The second important cost is about the only paying for your learning the language. So that the 86,000 which you are seeing over here, German language, which is all four levels cost. German A1 will cost you 16,000, German A2 will cost you 16,000, German B1 will cost you 18,000, and German B2 level have a two part, dot 1 and dot 2, 18,000. So overall sum, if we do, it comes around 86,000. So overall, if you think about the expenses, what you're going to bear to reach Germany is about 1,16,000, 30,000 plus 86,000, which you're going to invest for your future. You're not going to pay us or anyone. You are going to pay for your training purpose. That's it. And rest, what the Welcare Overseas Education is going to give you, even we have a very well experienced, established trainer. Those have experience more than 10 years, 15 years, 20 years teaching our professionals. And I am happy to say today, we have at present more than 600 nurses. We are training them. We are giving them preparation for language. We are helping them to get a job in Germany. And we are very happy for such things, to doing those social service kind of work in the particular in the Karnataka field. And still we are elaborating ourselves to going to the purpose of today, to coming for this particular webinar, to give you guidance for the Parul Nursing College, Parul University students, and the what benefits you can get from us. This, apart from this training, once you have your German language B2, we do the free degree or diploma recognition. We do the free your German document translation. We give you the free job placement. We arrange for your free accommodation for initial 3 to 6 months. So what happened in the accommodation part? Some hospital give you completely free for 3 months. Some hospital give you completely free for 6 months, and some hospital they give you free accommodation, but they will take a charge about 150 euros to 250 euros. They will cut the rent from your salary. So this is the how, depends on the which hospital you are getting your employment contract. Then also sponsored for free air ticket and the complete assistant visa application and complete assistant in Germany. So you don't have to worry from the beginning to start your journey as a staff nurse in Germany. We are there. Welcare Overseas Education is always there to help you, and we are into this organization from past 2008. So we are doing really well. We also helping to the doctors and dentists and nurses. So those medical aspirants we are helping. So this is all about the nursing job in Germany, and the criteria what we have discussed, what documentation you require, what level of German language you require, and what cost you have to spend for this particular program. So I think this is the very fair enough, where only you have to invest for your document assessment and your language preparation. That's it. You don't have to pay to any agent. We are not agents. We are an organization. I am also a member of Fair Recruitment in Germany. I am also a member of Indo-German Chamber of Commerce in India. So we are an organization. We are helping to those needy or the quality of nurse looking for overseas career. And when you go for overseas, it is always help you. If you ask me what are the demerits to go Germany, I will say there is no demerits to go Germany. Only the demerits is you have to learn the German language, which is an important. If you have German language, no other any demerits, because if you explore yourself in a particular overseas country, which are developed country and particularly Germany, you definitely going to learn and earn good amount of salary, as well as you going to learn, you are going to explore yourself. If you work in Germany at least 10 years, you can make yourself financially strong, as well as you can learn the advanced medical technology, which is going to which the Germany is using over there. So those the experience you are learning in that particular overseas country, you coming back to India, you can help to other our medical organization and improve our medical system in India. So this is all about the nurse job in Germany. So thank you so much for Parul University Nursing College and throughout whole staff. It is my pleasure to be here today, and thank you so much all.
Sir, thank you so much for your great session on the Germany ethical migration
sure.
for our
Thank you
nursing
so much.
students. I hope it will be helpful to our students. Definitely, sir, if any students are interested to apply for this, then we will contact you.
Sure, sure. Thank you so much.
Thank you, sir. Respected Naresh Bhati, sir, I again would like to thank you on the behalf of Parul Institute of Nursing as well as Parul University, Vadodara, Gujrat. Thank you so
Thank
much,
you.
sir.
Take care.